asana kunjano hikayato eto kaho kunjana hya arok at let's move forward in our agenda in Sosiki Vito to our superintendent of Navajo Nation Schools, Superintendent Bigay, and you want to give a brief updates and reports coming from the department. Superintendent Bigay.
Okay, Dr. Nez, good afternoon, everybody. It's not like all those who are in on the meeting. I'm trying to get a better view here. But again, thank you very much for joining us for our information update from the Navajo Nation Department of Education. Communication is so essential to bring everyone together, get everyone on the same page, so to speak, as you've often heard many, many times. And again, Johansson, schools out there, if you ever need help with your athletic programs, football, baseball, basketball, Johansson has a solid track record, the one who just gave our opening prayer. Excellent coach. He's coached all different teams at all levels, junior high, high school. And if you want a winning team, give Johansson a call. He can turn your athletic program around. I actually don't have very much from my office, again, for everyone listening. Just a few things. One, of course, is always to forward to us your updated reopening plans, your school reopening mitigation plan with the virus COVID-19 and the mutations that continues to spread amongst our community. And so please forward the updated schools reopening plan. And again, and ways and means to mitigate the horrific virus that is still in our community. So just a reminder on that. And a couple other items I just wanted to mention also. Some of the initiatives that we have going, we are making our DODE, Department of Education, very much a service delivery entity, meaning that we offer our hands to the school sites on ways and means to improve on measures of school success, meaning the achievement profiles in all the academic discipline, also graduation rate, also improving on attendance rate, reducing absence rate, and other issues such as disciplinary referral for students. And a lot of this are measures of school success that are required in many of the schools. And so if you need assistance in these areas, we have some solid track record on how we may again make changes to bring about what we call exceptional schooling for our kids. And so we are very much service oriented in that regard now with our DODE. And so far, I've talked to several school officials, board members, teachers, community members on what we call demonstration schools. And these are schools that we wish to work closely with, and schools themselves, they are willing, they have volunteered to work with us closely to bring about, again, the various measures of school success, as I mentioned. And so we have now about 8 or 9 schools that have expressed interest in Arizona, New Mexico, and we're looking into the Utah schools as well. And so please do not hesitate to contact us, either Dr. Nez or any of the staff here, or even myself through our website. And lastly, as I mentioned before, we want to recognize and acknowledge some exceptional work that your schools are doing, some outstanding programs you have in place for students, for staff. And we want to share this with all the other schools that we serve. It's important to share the success that we are seeing with our students and to share our success stories, if you will. And we want to upload these on our website so that these are some exploratory work that your school may wish to undertake. And so we are very much interested, again, in exemplary school practices, projects in place that you wish to share with others. We want to, again, showcase the success that all the staff and students are working on, the school leaders out there. And so that's pretty much the last item I just wanted to share with you. And we are making every effort on my part, especially to be out in the schools to meet with the various stakeholders, your governing board members, your superintendents, your CEOs, your principals, your teachers, your parents, parent committee. And again, to let them know that Doty Department of Education, we are here to help the schools in every way possible to become exemplary schools. And we have the documents, we have the evidence to show that schools can be turned around to exceptional educational practices. And that is pretty much what I wanted to share with you this afternoon, everyone out there. Again, our huge thank you for all of us, for all of you who are participating again in our weekly school communication. This is Dr. Nez.
Hakoshi, here to Superintendent Begay for your updates there. We do have several hands raised in the queue, starting off with Mr. Wakunet, who will likely elaborate on his comment made in the chat. Mr. Wakunet?
Yes, Dr. Begay, thank you. And Dr. Nez, thank you. Yeah, I had put a thing in the chat. I was really hoping that Dr. Begay, I know you're saying you're going out to different schools. You know, for myself, I haven't seen a schedule or anything like that. What schools you'll be visiting, when you'll be visiting. But I also thought it'd be really good if Dr. Begay, you could put some time together sometime for a private Zoom meeting with like all the school principals, or have something at Window Rock that we could come to if it's safe enough during COVID, where the principals could meet with you and tell them the concerns they have at their schools and other issues that they have concern with, whether it's with Doty or the BIE or at their school. I think that would be really, really helpful to understand where the schools are at if you could have a meeting like that.
Thank you.
I'm Bill Wachunas. I'm the principal CEO here at Delcon Community School.
Thank you, Bill. I hope you don't mind me calling you Bill.
That's fine.
Outstanding. A great suggestion. Certainly, I have a very flexible schedule. My priority, again, is to go out to the school sites to meet with, again, the stakeholders and the school sites, and I am always all ears. And I am very, very interested in all the challenges that you are facing and what you have done and what you are doing, and to explore with you some possibilities on changing these challenges into opportunities for development and growth. And certainly we can establish what you suggest, a meeting, maybe perhaps with the principals, and at some point also with the CEOs and superintendents, and also possibly with the board members, and certainly with the teachers. As I mentioned, I have gone out to at least one school and met with the teachers already. And I'm finishing out my 5th week here. And although I have my hands full, but my priority is school site focus. And so, Bill, we will work on a schedule, and we will shoot that out to the school sites as soon as we can. Thank you for your feedback.
Thank you, Dr. Begay. Thank you very much.
Great, thank you, Mr. Wachinas. We have our next hand raised from Mr. Toledo out of Natnijinjot.
Yad Ishmat, and then good afternoon, everybody. Dr. Begay, a while back you talked about school inspection. If you could follow up on that question of what kind of inspection you really need and when do you want them. I think we can provide these, but there are some different type of school inspection that occurs. So if you could make that clear. And then also, one of your remarks that you made about school improvement, I think these are very good concepts that you're bringing up. But what we need to do is meet up with you, since you're talking about model school, demonstration school, and we're recognizing exceptional schools and workers. And I guess what this really entails is a district plan, how we're gonna go about this. So I kind of feel that right now is a planning time for the rest of the school year, and we can put this together during the summer and start on what you're conceptualizing coming next school year, because right now we're almost at the tail end, or past the middle and the tail end of our school program. So I think these are very good ideas. So I'd like to bring it up to you, and I do agree with one principle that we do really need to meet with you and express our concerns, not only in education, but there's also other factors that we need to bring to your attention. Thank you for your time.
Yes, thank you, Mr. Toledo. So as indicated, the schedule as well as the further information of that will be coming from Dodie, and I'll ensure that Superintendent Begay is apprised of that. So thank you for your comments, Mr. Toledo. and the notion there that you brought up about the exemplary programs that are happening at school. So you can definitely send that to our PIO. He put his information into the chat, Mr. Cody Begay. So with that, we'll move on with our agenda for your questions and comments, as well as your feedback. I do see that our Navajo Nation president is on the line, so we'll move forward with that. President Nez.
Thank you, Dr. Nez. Aro are tanichinalki do tlashi o daisnol hierna kwa shanaho ado Dr. Begay, Superintendent Linigi do hier kudo hane nhichi konaning la do ultra no Linigi ultra not ani dan Linigi hier la Nihinanish Queech Adal Indo Dean Hitlia Isni Shiminakwa Lanitle Ado Lashi Hanne Ultra Hanne Kudo by Yale Titla so here Danadan Hidi Nido Leshik Edoshin a Shin Slido Tratnesani Bashin Twitchini Dashichedo Trachini Dashanala Shot toward a you see na shadow ado ko did just it in the oyo ya des kidia ado ni keni hinna la bida dol nanda to konla zel in the has tranda bini nagi she ko di zen hije kodaliagi na das tsia bikje na nishigi di de kusinskagi ze na da tsigi shi binina ado yego kon hikeni hinna zel in the has tranda ado o here yina nishidash on la ndez kdena kinacha so she kodonacha hens do o here dalihidi nishinabel Vice President Lizer. You know, just briefly wanted to again commend the school leadership for the great work that you have done throughout this surge. Well, of course, throughout the pandemic, but this recent surge was the biggest of all surges in terms of COVID positive cases. But because of our high vaccination rate, I truly believe we kept many of those individuals who got the vaccine but still caught the virus out of the hospitals because the hospital usage was, or being admitted was very low. And we appreciate everyone's diligence in getting our staff vaccinated, encouraging our students to get vaccinated. I've seen many of our younger generation coming to these vaccination events, getting their shots. So I commend the school leadership, staff for setting that example for our younger generation. Of course, our public health emergency order 01 and 02 of this year, 2020, are still in effect. We discourage people traveling off the nation. If you gotta go, you wear your mask, follow all the protocols. And when you come back in, that's what we do here because we have to leave the nation. And when we come back in, we do our rapid tests, so that we keep everybody safe in case we catch the virus. So that's something that could be a protocol for schools as well. And then the capacity is still at 25% on school events. I was fortunate to be one of those 1,800 people that got into the game on this past weekend at the Chinle High School Wildcat Den, and everybody was wearing masks. What we did too is we handed out N95 masks over there. So tonight, if it's okay, I think we're working on it now with Window Rock Unified School District to hand out more masks there, because people are going to be in line. We'll just hand them out. I know that N95, KN95s are in demand, but we do have some, and we've been handing them out at various events. So that's going to continue throughout these next couple of weeks, few weeks. We just let everybody know just to stay safe, and again, don't let down. We got a new variant out there, Omicron variant that's been identified here on the Navajo Nation. So similar to the main Omicron variant, we're still getting more information on that. I'm sure the EPI team will give you an overview of the new Omicron variant. There's a letter and number to that to identify that new variant. And the school reopening plans, Dr. Jim, we just met with her today. We will be reevaluating certain protocols for the HCOC in terms of contact tracing, because we learned a lot over this pandemic, and we just got to change our strategies as we see the spring coming. It's blowing outside already. Spring's here. It looks like it'll get warmer. We just don't know we don't know the future. We don't know what other variant will come in of COVID-19 onto the Navajo Nation. So we have to be prepared. So those are things that we are working on with the Unified Command Group, the Health Command Operations Center, and IHS, BIE, and you all. We just wanted to make sure that we continue to check up on our students. Some students are not coming back to school. We need to check up on those, as was mentioned last week, follow up and see what they need to, not fall behind on their academics. We are monitoring the state legislatures. There's some school bills that are moving through the process. 2 more days left in the New Mexico State legislative session. And so we will give the Department of Education through Derek Franklin, who is at our office, a rundown, because we do have people that are monitoring these bills. Of course, Dodie is doing the same thing, and probably many of you out there as well. One thing that we've supported all along, some of you that are working for New Mexico State Schools, right, is the salary increase for our teachers. And we appreciate the leadership of the governor of the state of New Mexico, and we have supported that. So we just thank you, school leaders, teachers, faculty, staff, bus drivers, everyone for doing a great job during this surge. And that'll be it for my report. And take care of yourself, mask up, and we'll see you soon. God bless.
Great.
Back
Thank
to
you,
you, Dr. Nez.
Thank you for your updates, as well as your reports and being apprised of what is occurring in and around the Navajo Nation, as we have a good amount of population and events that occur, and highlighting as well the sports. We know that many of our student athletes are doing an exceptional job. Some schools are hosting, so reminding our school leaders to be a good example for our youth as they go on to the court, as well as parents, grandparents. Being able to understand and conceptualize that it's good to practice those safe measures regardless of where you're at. So thank you, President Nez, as well as your team, and continue to be safe as you navigate throughout the Navajo Nation. So moving on, I do see that Larissa is online as well. So I'll pass it on to HCOC as well as DOH to give us a report. Larissa.
Thank you, Dr. Nez and Dr. Begay and Mr. President, for all your comments beforehand. I will go ahead and present the update. A lot of this has been mentioned on this call, so we will, yeah. Okay, so these are the updates for January 28th through February 10th. So as has been mentioned, good news, we are finally beginning to see a pretty good decrease in cases here. As you can see, this is also supported by the infection rate, which is below 1. So again, whenever it's below 1, it means that COVID is spreading to less than 1 person on average for each case that is infected. So again, these are good signs that we are hopefully going to continue to see a decrease in trends of cases. However, overall, there's still a good number of cases that have been reported this past week here. So as you can see, 632 new cases were reported on Navajo Nation, which puts us at a rate of 399. So that's still a pretty high rate. And as you can see, some service areas are reporting a rate less than 200 cases, but most areas continue to report rates above 400. So although we are beginning to see, that decrease, overall transmission is still pretty high. So again, just kind of reiterating the importance of making sure to still wear your mask, making sure that your mask is of good quality, because that risk is still out there. Looking at our other metrics, we see percent positivity did go down slightly, though it's still pretty high. It's at 29%, so still pretty high, but seeing improvements. And on average, there were about 955 tests conducted on a daily basis this past week. In terms of occupancy, hospital beds are at 57% and ICU beds are at 67%. So still in that orange range. Overall, for vaccination status, and just an FYI before I go further into this, we did update the wording on these slides. So primary series now refers to completing like the initial 2 doses of either a Moderna or Pfizer, or receiving 1 dose of like Johnson & Johnson. Up to date now refers to having been boosted, as well as having completing that primary series. So among Navajo Nation, among Navajo Nation residents, about 121,000 have completed a primary series. And of these, about 77,000 are up to date. And so here you can kind of see what visually that looks like. In terms of overall case trends, we see Navajo Nation, again, we're seeing that decrease in cases, and we're seeing that the United States is also, again, seeing a decrease in cases. So overall, across the different states and jurisdictions, we're seeing rates go down overall. So currently the highest, or the states with the highest rates, are Alaska, Kentucky, states more in the western region, as we'll see in the map here. But overall, we're seeing an improvement across the board. So as you can see on this map here, and just again, FYI, a little note, CDC again changed the coloring of these categorizations. And so now most states are above a rate of 180 cases. So we're seeing here, overall improvements. The kind of areas of the United States with the highest rates continue to be kind of like these western regions and kind of like these eastern regions here. But we are seeing improvement in our border states, though these 3 of these are still kind of high up there in terms of case rates. In terms of community transmission, we are seeing a few counties improve, although majority, especially the counties in our surrounding areas, are still pretty high community transmission. Again, this map is created by taking into account new cases and percent positivity. In terms of strain surveillance, as was mentioned, if we continue to see more Omicron cases be detected on Navajo Nation, and we did receive our first report of identifying the first BA2 case on Navajo Nation. So far, the data indicates that the BA2 sublineage is pretty similar to the original Omicron strain. So again, just reiterating the importance of making sure you're up to date on your vaccines, as that is still our best kind of tool to fighting COVID and all these variants here. And again, just across the country, we are seeing, the Omicron again continue to predominate, and now we're beginning to see BA2 move in here as well in the pink. So beginning to see that variant kind of be spread a little bit more widespread. And in terms of high risk chapters, 64 chapters made it to the high risk list this week. Of these, 55 chapters were on the list last week. And 21 of these chapters have been on there for more than 6 weeks. So overall, cases remain high and in the red threshold, again, likely driven by the Omicron variant, just because of how rapidly Omicron is transmitted. Test positivity remains high and hospital capacity remains in the orange. So overall, risk level, it still remains at red, though we are seeing improvements. But again, just reiterating the importance of mask wearing and being up to date with your vaccines. And so this concludes the update this week, and we'll take any questions or comments y'all may have. Thank you.
Great, thank you, Larissa, for the information there in the presentation. Good information, some good highlights definitely from previous reports. So we do have a question here coming in. Now that the over-the-counter COVID-19 test kits are available, would that have an effect on the number of positive cases being reported?
A great question, and yes, it will have an effect. So if an individual tests positive on a home test, and it's not reported to a facility, then we won't receive the data, so to speak, to count that as a case. So some facilities have been trying to communicate with their community to try to encourage individuals to report their home test kit results to these facilities, though as with all science, we can pretty much assume that not everybody is going to be reporting their test results. So it will impact it. It's still pretty early on to kind of know to what degree it's impacting our reporting. But we are keeping that in mind, that people who do test positive using home test kits, we may not be aware of. And similarly, I know your question was just referencing to cases, but it similarly may impact that percent positivity that we report. So for example, if more people are using home test kits to just confirm whether or not they have COVID, and they only search out like a PCR test to like have a confirmatory test, then we may see that percent positivity stay high for a bit more time period, since we're not seeing as many negative cases come in, especially if people are kind of using the home test kits to confirm their negative status. So in short, yes, home test kits, can affect these measures. It's still a little bit early on in using these tools to kind of be able to quantify how that, what that effect is. So, yeah.
Great, thank you. The next question we have here is, in the test kit we use for our school, it does not say what variant the person tested positive to. It just says COVID positive or flu A or flu B positive. How do you classify the school's reports for Omicron or Delta or other variants?
Yes, so I can't find the question in the chat to read it, but so the question is, how are the tests or how are the variants being identified in B tests, correct? So the cases that are identified as positive are sent to a facility that then sequences that sample to identify what variant that case has. So, since it doesn't really affect clinical decisions, that for this reason, patients are not notified of what variant that individual may have, as most variants are still being treated, I think fairly similarly to where this is why a patient may not necessarily know what variant they may have.
Okay, great, thank you. And with the new guidelines, what is the classroom capacity recommended for each phase within the Navajo Nation? Shayla, is that in the school framework?
Yeah, so in the framework, we don't have the capacities. Essentially, there are no more, let's see, yeah, there's no more percentages, though those percentages are given in the public health orders for gatherings. Rather, from red, orange, yellow to green, the school is open as long as there are additional mitigation strategies put in place. The higher, or like the closer to red that we are in. If the nation moves to purple and that's put out in a public health emergency order, that is when the schools will be open only to students with special needs. So again, there's no percentages for capacity anymore.
Great, thank you. Also, in addition to that, Dr. Jim had included that there's no classroom limit other than considering 6 feet distance instead of 3 feet. Also, to the question posed about clearance letter there, Dr. Jim, thank you again for including in the chat the response there that clearances for return to work and school need to be addressed from the health command. Is that something we can address now, or are you implying that they need to reach out directly to the health command center? Dr. Jim? Okay, I'll circle around that to get clarity there. But Larissa, we do have another question. Home testing can also, okay, never mind, sorry. So where did you base the report for Omicron cases, Delta cases, et cetera? Are reports from schools who can test on their own included there?
Yes, I'm seeing that comment in the chat. I'm not sure which report is being referenced here. Yeah, I'm not familiar with a school report that has specifically outlined the variants.
And I think, and Dory, correct me if I'm wrong, but I think on the presentation that you provided, how you had identified the various variants that are being reported on Navajo. So I think the question there is posing that, are the reports from schools who can test on their own included in the report that you provided? But earlier I did hear that you mentioned that those aren't reported to like health facilities or anything, so it would not be included. Is that correct?
So the question is, if our tests that the schools are conducted, are we receiving the results from that? I'm not sure how that information, like how that data flow works. If I know we receive our case information from the state, so facilities report to the states and then we receive that data from the state. But that's as far as I know as to the data process on that flow.
Dory, can you clarify your question? Or is the discussion addressing your question? Feel free to unmute yourself to further clarify. What
Yeah, okay. We can test on our own because our school now is a COVID testing center with our own CLIA number. And so when we test, it does not say Omicron or Delta. And Larissa said that the state provides them with the report. So the report that we send to the state or to the, when we do our simple report, it does not say it's Delta or it's Omicron. It just say it's COVID. So my question is, when I was looking at Larissa's report, the number of cases of Omicron, number of cases of Delta, I was just wondering, where do this figure come from? How did they classify it? Where do they base it? Because in the test strip, it just you will only see COVID positive, flu A positive, flu B positive, but it does not say Omicron positive or Delta positive. How do they classify? I'm just curious.
Yeah, so great question. And so as soon as a case is identified as being COVID positive, it's sent to like another lab for it to be sequenced, genetically sequenced, so that the variant can be classified as to what specific strain it may be. So it may not even be, for example, Omicron, Delta, but it's most, I don't think there is a facility that does their sequencing in-house, but most sequencing happens external, like in a laboratory. So hopefully that answers your question. Yeah, I'm sorry if
Larissa, this is Sheila. Can you, just to clarify, so the tests that are done in schools, those are separate from the tests that you're talking about that get sequenced, right? There's no connection between in-school testing or testing done at home with the at-home tests and the testing that is done at a facility, right?
So at-home tests are not sequenced since we don't have those samples. I'm not sure of what the test kind of data flow is from the testing that's being done in schools. I don't know if there's anyone from the testing team that can further elaborate on that. That's currently on the call, but unfortunately, I'm not sure, how the results from the testing that's done in schools, like how that fits into this whole process.
So is there anyone from the testing team able to address the question deferred from Larissa?
Good afternoon, Dr. Nez. This is Nick. I'm not from the testing team, but I believe the testing team may be on a separate meeting happening today, a special event at IRB. So I don't know if they're able to make the call today. Thank you.
Okay, thank you. So I have documented the rest of the questions here. So we will certainly revisit those. We do have one more item on the agenda that's left. I know we have pressing questions at times or things that we need answers to, but we try to be respectful of the 1 hour time that we guarantee to our participants because a lot of our superintendents, principals work their schedules around this time. So we want to give you as much information as possible. And we do understand there are multitudes of questions that we receive, but not to worry, we document them and we will revisit them come next week. So those of you who are continuing to provide your comments as well as questions, do note that I am taking note of them. So with that, we'll meet the last item on, thank you, Larissa. And so we'll meet the last item on our agenda, and that's talking about the AIR grant. So as many of you know, several months ago, the Navajo Nation, particularly the Department of Education, received a 1.4 million grant to be used over the course of 3 years. And so our colleagues out of Navajo Prep, as few of our team members here at Doty, submitted a proposal. And in that proposal, we had identified a core area and topics that we wanted to address at a Navajo Nation-wide approach. And so this was a way that we could gear and meet as many stakeholders as possible. And so the ARRE grant, which stands for American Indian Resilience in Education, was awarded to Doty back in November, the latter part of November. And so at the time, since then, we're working internally to accept the grant so that we can start to get to work. So I wanted to provide you some key background information on it, as well as inviting a recruitment opportunity for those of you who serve as teachers or as consultants, or somebody that you may know who would be able to assist us in this endeavor of reaching a lot of our stakeholders across the Navajo Nation over the course of 3 years. And so, as I mentioned, this grant is aimed at designing, developing, and implementing a cooperative framework embedded within professional development, as well as a curriculum, which of course would be anchored using the NAM values and teachings. And so when we did a the source or resources that are needed here on Navajo, particularly with our students, it was leaning towards the social emotional learning of our students and the cultural awareness of our teachers, as well as our administrators, and then teacher effectiveness, because of all the different variations, right, that we've been subjected to because of the pandemic. And so those are the core areas that this professional development as well as curriculum would be able to target. And so through these opportunities of professional development as well as the curriculum, we'd be able to effectuate our students in terms of their social emotional learning, and then being able to also expand the cultural awareness of our teachers as well as our administrators, and then working with parents locally. So a lot of this work would be geared towards that, in developing something fresh and something new that would be able to perpetuate across all of our stakeholders, starting from our teachers, and then being able to train additional staff such as counselors or administrators, and ultimately working that into our students. And so some of the outcomes that we have seen is being able to have this type of tool that emphasizes culture or social emotional learning, so that our students, regardless of their form of instruction, would be able to improve and promote some of that learning geared towards graduation rates, leaning towards increasing those completion rates and things like that. And of course, also allowing our teachers to expand their knowledge and cultural awareness at the teacher or at the school level, right? And being able to understand the diversity that exists when it comes to our teachers and administrators on the Navajo Nation. So it's sort of a collective front, considering the values that are being used here and being able to project that into those that are educating our students. And so there are several opportunities for you to be involved in this work. And right now, all I'm giving is just sort of a small spiel of it. But on Friday, this Friday at 9 o'clock, I'll have an open information session where you want to learn more. So here we have opportunities that exist with curriculum development consultants. And these 5 individuals will be responsible for designing and developing the professional development as well as the curriculum to address those core areas that I mentioned. We're also looking for 5 advisory consultants who have the responsibility of reviewing and advising the final product for reliability and validity purposes. We also have 5 opportunities for consortium leaders. These are for folks who begin to train our local teachers and administrators on the professional development as well as the curriculum to serve as agents to support their efforts as it's ongoing. And then 5 teachers who would be responsible for piloting the design program and begin training staff within the agency. And the reason why we're focusing on the 5 areas is we want to be able to pull in from each agency so that we're very mindful and respectful of those that, or the stories or the teachings and things like that that exist across the Navajo Nation, right? And being able to service those specific populations once this program becomes finalized. And of course it's ongoing, right? Because we're here for 3 years, this program. And so I know that was probably quick, but I'm gonna put my email into the chat. And if this is something that you are interested in as a teacher, as a certified counselor, or you've done research in this area, then you are the type of people that we could use on our team. So as I mentioned on Friday, I'm going to be doing an information session, it'll be at 9 o'clock. So there's my email. Definitely send me an email if you're interested, or if you want to learn more. I can definitely elaborate more then. But yeah, so we're looking for several key folks, more than several actually, key folks to help in this endeavor. So I just wanted to highlight that and share that with you all as an opportunity for you to be involved in the work around social emotional learning for our students, as well as cultural awareness for our teachers and stakeholders. And of course, effectuating our teachers' performance and instruction. So thank you. With that, we are approaching the top of the hour. So you all have, yes, residential can be a part of this, not necessarily study, the research portion, right? Yeah. So thank you, Kirby. Send me an email if you're interested. This doesn't limit what school you are. You could be public, private, parochial. You service our students, so we're more than happy to help you or welcome you on board. So thank you. Thank you all. You all be safe and continue to safe practices.